Hey everyone, this is Joseph Katz with CoverRight. I am here today with CoverRight co-founder Tom. How are you doing today, Tom?
Good morning, Joseph. Good morning, everyone. Thanks for having me on the show again.
It's our show. So I want to continue the conversation about Medicare with you and help people make a better choice. So today's topic,
Yep.
how should someone evaluate a Medicare plan so that they're making sure that they're getting the best plan for themselves? So that's the topic. I want to start the question with the first question being, what's the best place to start and how do you start the process?
Yeah. So what's really important to remember, and what we help a lot of people with this, is that before you can enroll in a Medicare Advantage or a Medicare Supplement plan, which are the two types of additional Medicare coverage, you need to be enrolled in Medicare Part A and Part B first. So like we said in the last video, Medicare Parts A and B are like the foundation of Medicare. They're the parts that make up original Medicare. And so you're eligible for those parts once you turn 65, or if you're under 65 and have a disability. And what most people do is they visit the Social Security website or call Social Security directly, and you just need to fill out some forms, some paperwork to sign up for Medicare Parts A and B. You don't need to sign up to both of them together. Some people only sign up to Part A, and then they continue working for a period of time before they sign up to Part B. And then you need to start paying a premium when you sign up to Part B.
Great. So you mentioned last week, and last week we talked about, Plan C, which is also known as the Advantage plan. So how does someone know if the Advantage plan or the Medigap supplement plan is the best choice for them? Like, what are two or three? I know it's a big topic, so maybe just two or three ideas around how to look at that. And obviously, if someone wants to get into the details, we'll happily talk with them.
It is a big topic, Joseph. You're right, and there's a lot of things to consider, and that's something that we've kind of made our careers out of here at CoverRight is helping people to navigate this exact question, because it is difficult. For me, what I like to tell a lot of my clients is that it fundamentally comes down to really two things: your budget and your current and your expected health condition and your health in general. So when you turn 65, if you are happy to pay a higher amount for your healthcare, you're comfortable paying a higher monthly premium, and you don't want to worry so much about your healthcare costs when you see a doctor or go to the hospital or that sort of thing, then a Medigap plan is likely going to be a better option for you. But if you have a lower monthly budget and you're happy just to pay for your healthcare costs as you go, then a Medicare Advantage plan is often going to be a better plan for you. Now, regarding your current health, Medigap plans, because they are more comprehensive and kind of the coverage is more all-encompassing, they are typically plans that we would recommend to people who when they turn 65 are facing some health concerns. But it's really, really important to remember that you only get a guaranteed issue period once when you turn 65. And so you can't sign up to a Medicare supplement plan you can sign up to a plan, but you have to go through medical underwriting. And so that means that a plan can deny you coverage based on your health. So typically, if you have the opportunity, a Medigap plan is better if you're facing some health concerns. But if you're relatively healthy, you can sign up to a Medicare Advantage plan and have little to no out-of-pocket expenses across the year if you're healthy and not seeing any doctors at all. And so that's what some people prefer.
Just to clarify one point, so you can always sign up for a Medigap plan, Medicare supplement, later in a future year, but you will have to go through underwriting. Whereas if you do when you turn 65, it's guaranteed issue.
That's right. You have a small window when you turn 65 where you have a guaranteed issue period. But then after that, any company that you try and, or that you submit an application for will put you through a medical underwriting process. And that just means asking a few health related questions.
Right. And
they can deny you coverage. And yeah, unfortunately, I've worked with a few clients where, yeah, their coverage doesn't get through because they have some sort of underlying health condition. And so then we usually look to a Medicare Advantage plan.
Obviously, it's a complicated topic. So individuals need to really explore that deep with a professional. Mm-hmm. So how is price determined for a plan? You know, I know there's a lot of zero premium plans out there. Is that good? Is it bad? Or are there hidden costs? You know, obviously sticker price, you know, is the first thing people see, but then they may not realize what else is behind the wall.
Yeah. So for a Medicare Advantage plan, these are the plans that you will often see that have a $0 monthly premium. And this is something that a lot of people see and sounds too good to be true. And I completely understand how you might feel that way. There is no such thing as a free lunch here, and you do still need to pay out-of-pocket costs for services when you use them with a Medicare Advantage plan. So if you see a doctor, go to a hospital, get some lab tests done or some x-rays, there'll be an out-of-pocket copay. So the plans are not really free, but a lot of them do have a $0 monthly premium. And the way that they're able to offer that $0 premium is because these plans are all federally subsidized. And by you paying your Medicare Part B premium and then signing up to a Medicare Advantage plan, you're basically telling the government that they can pay this Medicare Advantage plan your Medicare Part B premium. And so that's how these insurance companies are able to have a $0 premium plan.
So another really deep topic to dig into is, you know, what are those doctors going to charge? What's the x-ray going to cost? How much is that medicine going to cost? All that good stuff. Yeah.
And that varies between the different Medicare Advantage plans. And it's important to really consider the types of services that you think you might be likely to use more or less. And that can make a big difference in your total cost.
Out of pocket.
That's right.
So obviously this is complicated. Lots of noise out there in the market in terms of how to select this. You know, the zero premium plans have seemed enticing. So how is a consumer supposed to go about, you know, getting a good recommendation? Are there tools in the marketplace that are available for consumers to explore?
Yeah, that's a good question. And there are some tools that are available. There aren't too many tools that we think work really well online. Then the government does have its own search tool on Medicare.gov, and I think the government is required to have that tool because it's effectively a government-run program. But feedback we get is that tool can be quite hard to use and hard to find the details of plans. And you also can't speak with a licensed advisor. That the government doesn't have licensed advisors that work and help beneficiaries. So that's what we have kind of created here at CoverRight, is a platform that allows people to firstly learn about Medicare and the topics that we're discussing in these videos, Joseph, but then also work out which type of plan is best for them, whether that's a Medicare Advantage or Medicare Supplement, and then review their different options on our website. So we feature all of the plans from most of the carriers that are featured on the government website. And so you can log on to our website and see all of that information, and then get in touch with me even, or one of our licensed agents who can help review those options with you.
Everyone's going to want you after these videos, Tom. You're going to be a busy guy.
I'm happy to help.
Obviously, there's a lot to pick apart here for anyone who's going through this very important decision. So I appreciate your time, Tom, today. If anyone has more questions or wants to get in touch with Tom, you can reach out to hello@coverright.com. We'll put contact information in the description below, and we'll be back every week for the foreseeable future with another video. Tom, thank you very much, everyone. Thanks for listening, and we're here to help.
Thanks, Joseph. Thanks, everyone.